I checked the patient's medical record for the healthcare provider's order. And can I get your name and date of birth, please? Perfect. And today we're going to be inserting a Foley catheter due to urinary retention. So I would provide privacy and perform hand hygiene. And during this procedure, if I need any assistance, I would ask. I would raise the bed to a working height. And then I would lower the bed rail. And then I would get the patient comfortable, providing privacy to her area and only exposing her perineal. Then I would put a wet mat underneath her. So then the next thing I would do is I would have the patient go into the dorsal recumbent position, asking her to relax her thighs just so that her hips could be easily rotated. And then I would perform hand hygiene once again and grab a clean pair of gloves. All right, and then I would use warm water with some soap, and I would wash the perineal area, folding the towel over itself so we weren't getting any germs in there. And then I would dry the area completely. All right, and then I would remove these gloves, perform hand hygiene, and then now I would begin to get my sterile field ready. I would have this out of the bag, but I couldn't get the bag back on. And I would use this as my garbage can. And then I would begin to open up my sterile kit. Placing this under her thighs. And then I would put my sterile gloves on. All right. And then using this, I'd fold it over my hands and place this on around the peri area. And then next I would put the antiseptic solution onto my cotton balls, and then I would pour lube in here, get that ready. And then I would attach my syringe to my balloon port. All right, and then take out my specimen container, kind of loosening the lid up a little bit. And then I would bring my supplies down to the bed. So then the first thing I would do is I would use my forceps and my cotton balls, opening the labia, wiping superior to inferior, not breaking the sterile field. And then one more swipe. And then I'm just gonna place these over here. And then next I would make sure that my catheter had lube on it. And I'd place that back up here as well. And then I would insert the catheter. Until I saw urine. which I see urine, so I would go 1 to 2 more inches in. And then I would begin to inflate the balloon port. Slowly, and I would also be assessing for any pain on the patient. And then next I would remove that, remove my gloves, perform hand hygiene once again, and then I would apply a new set of clean gloves. I can get these ones on. Okay. Okay. And then I would attach this to the side. It's okay. And then making sure I can see the balloon port. And then I would fill my specimen container up to 20 milliliters of urine. All right, and then I put the cap on, and then I would remove my gloves again, do hand hygiene, and then I would clean up the area. Also, I would make sure that this was attached to her thigh so that I'm noticing any kinks or leaks or anything like that. And then I would clean up my supplies. So I would rip this in half, throw that in the garbage, get ready with any of my other items. I would get the patient back into a comfortable position. And then I need to, before I do all that though, I need to palpate the bladder and notice any leaks or anything like that. And I'll cover her back up. Raise the bed frame, lower the bed frame. And then I would perform hand hygiene again and document my findings. And if I didn't notice any urine in the next hour, I would notify my physician right away. Thank you.